So as a result of attending this 90-minute experiential workshop, experiential because y'all will be working with me, we're going to define what a grand family is and the needs of its members. We're going to distinguish between how a family peer support workforce differs from a grand family peer support workforce. And then we're going to identify strategies to create the grand family workforce. Okay, so I've already told you what we're going to do. You all, I was going to put you all in breakout rooms, but I'm going to see how it goes. Right now, we don't have really high numbers. Gail, what number of people do you see right now in this group?
I see that you have 17.
Oh, you see that we have 17. So maybe we might be able to break out, but we'll see. We'll see. Let's get to that point before we move forward. So I need to find out who is in the room. And so we're going to do a waterfall chat with this. What I'm going to do is I'm going to ask you a question. You're going to write that, you're going to type that information into the chat. You're not going to press send until I ask you to press send, okay? So let me move my chat box so I can actually see. So I want you to write whether or not you are a birth parent, someone who works for a Department of Social Services or Child Welfare, whether or not you're a former foster care youth, whether or not you are a kinship care or a grand family head of the household, whether or not you are the head of an agency or an administrator of an agency that does work with family partners, or if you're some other agency head. If you are something totally different than that, also type that. So now what I want you to do is go ahead and press send. Okay, so what I see for the most part is that people are telling me that they are parent support. See a couple of people saying that they're kinship. I'm not sure what it means when these folks put everything, but I'll get to that. Grandparent raising grandchild. Okay, keep going. I don't think that's everybody. I don't think I've seen 17 entries yet. But okay, I get the gist of it. Okay, so that was important for you all to see. What I think I want to do very quickly is come out of this, because I always like to know who's in the room. So I'm going to stop sharing so I can see my entire screen. I'm going to call on people individually because I can see your names, whether or not I can see your faces. And I'm going to ask if you are a member of a grand family, and I'm going to explain very specifically what a member of a grand family is and the state that you're from, okay? So a grand family member. A grand family is created when a grandparent or other family member, that could be a sibling, an aunt or uncle, a cousin, a great-grandparent, or a fictive kin, meaning close family friends like the godparents, or those people that are not biologically related to you, but you're really not sure because they're always there at all your family functions, always have been, okay? They raise the child of a relative unable or unwilling to parent. Now, I have heard recently, even yesterday, a couple of people who have said, well, I'm a grandparent. That's not the same. Well, I'm an aunt or uncle. That's not the same. If you don't have primary care for that child, as in you are responsible for whatever happens with that child from day to day, and you are paying all of his or her bills, then you are not the head of a grand family. So I'm going to start with Miss Melendez, who has yet to tell me what her first name is. She's going to tell us today what her first name is, whether or not she is a grand family member, and what state she is in. Miss Melendez. You're on mute.
Okay.
My name is Marixa Melendez. I'm helper on my granddaughter. So growing my grandkid in my home. So
Are you responsible for them legally and financially?
no, and
Okay, so you're
support
just a
her
grandma.
and support my granddaughter
Okay, so
in
you're
my house.
you're just a grandparent. And what state are you in?
And I stayed in Michigan, Detroit,
Michigan.
Michigan. So,
Okay,
but she have one
Letitia is
baby.
next because we got to go through a lot of people.
Yeah,
Letitia
but
is
I want to
next.
explain to you, she have a
Okay.
baby. She have a baby when she have a 17 years. She come in Arizona and my home and supporting her for a lot of
But
years.
she's there. If she is
there.
there,
She's
if
there.
she is in that household, you are
Yes.
not the head of a grand family. She is the birth
Exactly.
parent. Okay.
Exactly.
Letitia, who are you? Are you a grand family member? And what state are you in? Letitia, I think it's Letitia McKinney. Okay. Danita, you're next. Unmute.
I'm in another training, but no, I'm just a parent and I'm from Kentucky.
Okay, great. Crystal, you're next.
I was in the past, but not currently, so I'm not going to fit your definition.
Well, I'm going to keep past people in. And what state are you in?
I'm in Pennsylvania.
You're in Michigan? Okay,
I'm Pennsylvania.
You're Pennsylvania. Okay. Kelly Bailey. Okay. Phoebe Malloy. Oh, wait a minute. Kelly came back. Okay, Kelly.
Hi there. Sorry, lost my buttons for a minute. So, I do not have custody of a grandchild. I'm not raising a grandchild.
Okay, and it doesn't have to be a grandchild. It could be a sibling, aunt, a niece, nephew, cousin.
Nope, not raising any of those, but I do train parent support partners who sometimes are grandparents and who support other grandparents.
Okay, so because I'm gonna be making a distinction because I need for y'all to hear me when I make my distinction. Jan?
I'm a family support partner in Arizona, and I am
Okay.
not a grandparent.
Okay, you're not a grandparent or a cousin or a sibling or anybody raising your relative's child. Okay,
Correct.
Phoebe, next. Okay, I'll go to Kelly. Kelly Bailey. Did I already go to you, Kelly? I did. Okay, Deborah Price.
Hello, I am a grandparent that is
Raising a relative.
Hi,
Deborah. Are you the primary? Yeah, y'all know y'all not supposed to be cross-pollinating like
Together.
that. Deborah, are you the primary caretaker of that child?
I am.
Yes, I have legal custody.
You,
Okay, great. And you're in what state, Deborah?
Virginia.
I am in Georgia. Oh, well, we got two Deborahs. Okay, I'm sorry.
Oh, wait a minute. I'm talking to Deborah Price.
Okay. So yes,
So-
I have 10 granddaughters that I've had since the NICU.
And you are in what state?
Virginia.
Virginia. Okay. Debbie Burnt. Burnt. Is that your name? Okay. Okay, wait a minute. Phoebe, are you ready to speak? But I can't hear words you're saying.
Phoebe, you need to unmute yourself.
She's unmuted, but we're not hearing her. So I'll come back to her. Julia Benjamin.
I am a Camden County family support partner. We're out of New Jersey. I, in the past, did raise my 3 nieces for about 5 or 6 years.
Okay. D. Suzette Brown.
Yes, ma'am. I am a grand family. I have legal custody of my granddaughter, and I'm from Georgia.
Okay. Tabitha.
Yes, I am. I am the second cousin. I adopted my second cousin. She's now 31, but I adopted her when she was like 6 or 7. So in the past, yes. And I
And you're
am
in what state?
a parent support from Michigan.
Michigan. Okay. Betty Jo Lapin? Betty Jo? Okay, well then, Melissa, are you a Grand Family member? And what state do you represent?
I am not a Grand Family member and I'm in Pennsylvania.
Okay. Kimberly.
Hi,
Hi.
I am a grandparent family member. I am raising one of our adopted children's babies since he
Okay.
was 22 days old and he's 21 months old, and I live in Virginia.
You live in Virginia. Doris Key. Phoebe is telling me that she is a grandparent representing South Carolina and Georgia. So Phoebe, are you the legal custodian of those grandchildren? Like you got full legal custody and the birth parent is not involved in taking care of that child? Okay, she's going to type that in for me. Doris, you're next.
I am the peer support coordinator here at Family Support Organization of Essex County. I am a grandparent and a great grandparent, and I do not raise. I don't have legal custody, and I don't raise them. I just
Okay, you're just being a good grandma.
Yes.
Danielle.
Yes.
Danielle.
Hello. No, I'm not a grandparent. I don't think I'm old enough to be a grandparent yet.
And you
But
could be a sibling, aunt, a cousin.
no, what
uncle?
I was gonna say is I serve several families who are grandparents but are the guardians or in the process of adopting. And then also just reflected back on my relationship with my grandparents. I was closer to them than my own two parents. So
Okay. Hazeline. What is your grand family status? I think Hazeline has disappeared. So have I gotten everybody?
No,
Have I
I'm
asked
here.
everybody?
No,
Hazeline, there you are. Hazeline just moved on the screen. Hazeline and then
Yes.
Hope. So Hazeline, what's your status?
I don't have grandchildren, but there are a lot of grandparents in our agency. that receive our
I just want you to
services.
answer my question.
Yeah.
So I'm trying to find out if you
Don't have any.
are a grandparent or aunt or uncle or great grandparent or fictive
No.
kin raising a relative's child.
No.
Okay. Hope.
Do I have to leave?
No, you do not. Hope.
Yes, I am a grandparent co-raising with the grandfather of my granddaughter.
And you're
And
located
from
where?
Georgia.
Okay. Now I want y'all to tell me, why am I being nitpicky about this? Why am I being nitpicky about this? Because I'm being nitpicky. Why am I being nitpicky about this?
Because there's a different role. We didn't ask to be raising our grandbabies. It wasn't
We
something that we
didn't.
planned.
And I think it brings on awareness of the situation.
It does. So here's what I want to say to everybody here, because I have heard so many things that make the hairs on the back of my neck stand up. Just as it is important for we to have family peer support who have been involved in the raising of children that have mental health and substance use problems, we need to understand that there is a clear and distinct difference between that population and grand families. And y'all keep going back to grandparents. Well, here's what you need to know. I walked into my aunt, my paternal aunt's funeral. She died. I found my first cousin was there, and the daughter of my first cousin, my second cousin, was there. Social services was there at the funeral, and I was like, what are they doing here? Why are they here? They were getting ready to put my second cousin back into foster care. Now, you know, when you aren't there every day and you're not all into everybody's business, and I try to keep my privacy, you don't know all this happening. Even when you are up in there, people don't tell you all their business. And so I didn't know everything that was going on. However, I walked in. I'm not a grandparent. There are many people who are parts of grand families that are not grandparents. Grandparents are the group that is recognized. There are many of us. Siblings, number one, oh my goodness, siblings don't get any recognition. At least aunts and uncles get some recognitions. Cousins, they don't pay us any attention either. Fictive kin, but we're all there, and all of us make a grand family. So let me show you, let me go back to my slides so that you can see. Going the wrong way, okay? So a grand family is created when a grandparent or other family member, these are biological relatives with the exception of fictive kin. And fictive kin might as well as be biological because they've always been a part of the family, okay? But when they come up to raise the relative's child, then they make a grand family. This is not the same as a grandparent helping a birth parent in terms of raising a child. It's not the same. There's a whole lot of stuff that happens in these families that doesn't have anything to do with that. Yes, there are relatives, there are grandparents, there's aunts and uncles, there's cousins who live in the household with the birth parent and are helping to raise the child, but they are not the head of a grand family. And so I need to make that clear and distinct because it's different. And so just like you have specialized knowledge because you have dealt with raising a child that has some mental wellness issues, the same is true here. And so this means that we've got to have people that have this lived experience, that understand this lived experience to be a part of this. Now, I just put up a website for you all because I want you to find the numbers. There are grand family fact sheets. They can be found on this particular website that I'm giving you here. So on this website, they have information in English and in Spanish in terms of the numbers of the number of grand families in the state. They'll give you numbers as it relates to grandparents. Again, the numbers are low because they don't share any information except that of grandparents. And there are a lot of aunts and uncles and cousins and great-grandparents that are raising these children that are not listed. Siblings, again, there are so many siblings that are doing really good stuff. They don't get any resources. They don't get counted. But they need help. So let me move this. Okay, so there are two terms, and I have created my own terms. I need to explain this to you. There's kinship care and there's grand families. I have made a distinction. I have made a distinction based on my lived experience, in 2003, I went to my aunt's funeral. I didn't understand what was going on. There were these people there that were telling me I couldn't take my cousin to Macy's to go get her, appropriate attire to go to the funeral. And I'm looking and saying, who are these people? I've never seen this before. That is when I found out that child welfare was involved with my cousin's life. I didn't know that prior to that. That's not like something you share at a family reunion. So I didn't know that. I learned that there is a difference between kinship care and the care of relatives that are not kinship. Kinship being part of the child welfare system. I have made it all inclusive by talking about people who are raising their relatives' children as being grand family members, whether or not they are in the child welfare system. Now, here's the kicker. If you look at the statistics, you will find that on average, most children that are living with a relative are not in the child welfare system. The numbers are 1 in every 19 children living with a relative, those are the national numbers, are in the child welfare system. So that means 18 children nationally that are living with a relative are not in the child welfare system. When I look at the state that I live in, North Carolina, it's 1 in 31, which means that 30 children are not living under the auspices of child welfare. They are not ward of the state, and they get no support whatsoever. In some states, there may be some support. In most states, there's next to none, if there is any. And so I've made a clear distinction, very different. Anybody want to ask me some questions about this? Because we can get into this real quick. So everybody kind of knows this, that most children that are living with relatives are not in the child welfare system?
I am glad, this is Hope, I'm glad you brought that point up, because I never really thought about it like that, but looking at my situation, that was one of the things that I tried to avoid my granddaughter going into the child welfare system. So she, her grandfather on her mother's side, and she's my son's daughter, we both co-parents with her, but she lives with him. So I'm glad to know that, and looking at the stats, the numbers.
So Hope, here's the thing, and this is the thing that people really don't want to talk about. When people ask, there are studies that have been conducted. When people go and ask, well, would you like to be a part of the child welfare system? Families consistently say, no, we don't want to be a part of the child welfare system. We stepped up to keep the child out of the system, but everybody's trying to put them in the system. They don't seem to realize some of the things that come with the system. So in my case, me, well, yeah, I'm using my income to raise my cousin's child. Yeah, there's a lot of unexpected expenses. I didn't have before school care, after school care, grooming, extra clothes, an extra mouth to feed, an extra bedroom. I didn't have all of that. None of that. All of those expenses needed to come from me. Those are a lot of expenses, and I only have one child. Some people get 2, 3, 4 children. That's a lot of expense. And then people say, well, just become a part of the child welfare system. Well, here's the deal. I didn't do nothing. I didn't have any abuse or neglect. I didn't do anything. And for you to tell me that you need to come and inspect my house, that I need to fill out all this paperwork and do all of this stuff, that's not something I want to do. It's intrusive. There are people who have told me that they have to get permission to go out of town, to go on vacation, to have this doctor as opposed to that doctor, this school as opposed to that. I'm not going through all of that. I'm already making a sacrifice saying I want my relative's child to come live with me, which is a lot of work. But then to do all of this stuff with the state, relatives are consistently telling bodies not interested in that. And then they keep saying, well, then we won't give you any support. But here's what happens when we don't give support. When we don't give support and families run into challenges, and there are significant challenges that they can run into, if they get so frustrated that they decide to return their child to child welfare, is that child going to feel better or worse knowing that family has given up on that? That's a question I'm asking you. Okay, wait a minute. I see a bunch of hands. So I didn't see those hands before. Okay, so Crystal, yours is the first hand that I see. Go ahead and unmute.
I think with families, we're faced with either seeking help through child welfare, which you just described all the reasons why we don't, or the alternative is to take our family members to court for child support, which we don't necessarily want to do.
Well,
And
do they have any money?
Right. And even if they don't, in the state of Pennsylvania, they're going to assess them a minimum amount per month that they can't even afford to pay. And then they can end up in jail for non-payment. I mean, it can become a vicious cycle. And
families aren't going to do that. So even when my first cousin was getting on my nerves because she was doing some stuff, and I'll get into some of that in a few minutes. So there's all kinds of stuff. I was listening at the workshop yesterday that somebody was doing about grandparents raising grandchildren, and she was talking about, you know, the challenges with the computers and the, you know, different resources. And I was thinking, well, shoot, if only it was limited to just those things. Yeah. Families do a whole lot of stuff. Birth parents have issues. Children come up with issues. Then you got your own feelings that are coming into play. There's a whole lot of stuff going on beyond computer stuff. And I was thinking, if only that was it, I could find somebody to teach me about computers.
Absolutely. We're put in an untenable position. And it's not okay that our states don't recognize that there's a need for support that doesn't inflict the monetary damage on our relatives who were, you know.
Yes. And even the fact, which blows my mind, the fact that they make a difference between, don't get offended, stranger care or relative care. That there are significant differences in terms of the compensation that is provided between those two. Major issue. Okay, Crystal, gonna have your hand go down. Danielle, you're up.
Yeah, I was just interested while you were talking, and thinking about the families that I served this in the same situation. How then, if they don't have any involvement from the state or, you know, outside agency, will they be able to provide, like when the child has to go to the doctor or enrolling them in school, and how if they don't have any type of legal documentation saying, hey, I'm this child's sister, aunt.
So that's what has to be emphasized. That is what has to be emphasized. Now, I will be honest in telling you that I was fortunate in that I had a cousin. I lived in my child came from New York, which is my home state. I was living in Virginia. I called my cousin in California who knows everything. She flew to New York to go with me. She said, we got to go to court, girl. You got to go and get guardianship. I didn't know anything about any of this. Didn't know anything. She guided me through. Most people aren't guided through.
Right.
You do need to have some type of formal something to help you, because otherwise, and here's what my case was. I went to court, but court said, we'll solve this stuff for you in the next visit to court next month. And I was like, well, wait a minute. Well, I've got her today. So so I brought her back to Virginia and tried to enroll her in school with the paperwork that I had from the court. And they said, well, we need to have a hearing. I said, excuse me? They said, we need to have a hearing. I said, hearing about what? I'm bringing her here. I need to enroll her in school. And they said, well, we're going to have a hearing and we'll let you know. Now, what would happen if they told me no? And I had at least a piece of paper saying that I was doing something in court. If you don't have anything, you're going to have problems getting them in school, dental care, health care. What I had her eventually, because I had before and after school care, because she needed to be in school after I needed to drive to work. And she got out of school before I got home from work. So it's like she had to be somewhere. So I had to enroll her in the YWCA. They had a before and after school care program. Fortunately, I had some income to pay for that, but I also got a scholarship. What if you don't know to go and see if they got a scholarship?
Well, in between that time that you had to have the hearing in Virginia to enroll her in school, what did you do?
What did
How
I
you
do?
handle that?
I had a mother, and she babysat. I had a mother, and she babysat. So if I didn't have that mother, I guess I would have needed to take off.
Right.
And I did this, you know, I had an office that was open to me doing this. There were many a days where I brought her to my office and had her there with a VCR thing, and she'd be, you know, in a corner looking at her VCR and what have you during the day, or doing some homework or doing some reading, doing whatever. But I had an office. A lot of people don't have offices. You know, even, I'm going to be honest, even with the whole court proceedings, there were 3 children in my life. I was supposed to take all 3. Thank the Lord I didn't take all 3, because I would not be sitting here before you sane. But a distant relative, actually fictive kin, because this was the niece of my aunt who died. It was her best friend's daughter, okay? And so she took the boys. She also was law enforcement, so she had a shield. So when we went to court, she showed her shield, and we, you know, went on to the front of the line. Those lines were long. There were a lot of people standing on those lines all day long. As it was, I got shimmied up to the front of the line, but I was there all day long. These are long proceedings. Most people don't know what to expect when they get there. I didn't know. They don't know that they've got to, you know, present a case to be able to have the child come to live with you. And so that's what we did. But we need people to prepare. Now, who is best to prepare someone to know about all of this stuff? Am I better prepared than that person over there? Probably, yeah. Because I had to go through it. Because I had to go through it. So why do we need grand family peer support workforce? The numbers of grand families, they're going up. They're not going down. They're going up. And here's the thing that I also know. These cases are a lot more complicated than they used to be. My mother is 86 years old. Her mother died when she was 10. Her mother died when she was 10. And when she died, they felt, granddaddy had 3 daughters and she was the baby. She needed to go live with Aunt Mamie in New York. So she went to live with her aunt. They have all this paperwork, whatever. She could just go to school, do whatever Aunt Mamie said she lived with her, and that was enough. That's not the case now. My mother's mother died. She didn't have any substance use issues. She didn't have domestic violence issues. She didn't have a parent that was incarcerated. If we look at the reasons why children are going to live in these grand families right now, substance use disorder, number 1, domestic violence, and then incarceration are up there. There's other reasons as well. Deployment in terms of military, deportation in terms of immigration and all of that stuff. Death, which was part of my scenario, but my scenario was complicated by more than that, just that death. Grandma had her granddaughter for a reason, and that was because mom had a substance use disorder and she was in and out of prison. She was, you know, doing all kinds of things in terms of her lifestyle that were just not appropriate for her to be raising a child. And in fact, she didn't raise any of her children. She had 3 children. She didn't raise them. Grandma raised 2 of them, and then the other paternal grandma raised the other one, okay? In terms of what happens in these families. Okay, so here's the thing. My first cousin, remember, I raised her child, who's my second cousin. Kind of like, I think Danielle was the other person raising a second cousin. Here's what happened for me. And Suzette, I'm sorry, I see your hand. I'm gonna get back to you in just a second. I do see that hand, and I need to see if there are others in chat that just aren't on my main page. But when I was at that funeral and I said, okay, I don't understand, who are these people? Why are they here? Why am I hearing whispers about children in our family going to the foster care system? What exactly is going on here? She said, I don't know. And I'm thinking, what you mean you don't know? Now, I know she had been in and out of treatment, but I'm thinking, you don't know. Okay, so me thinking I'm Superwoman, I'm going to save the day. Crazy, crazy. What I did is said, well, let's call a meeting with social services so I can understand what's happening. And if you don't know, then we need to find out, because why are the children going into foster care? You're here and you say you're not using anymore. We called a meeting with social services, and I'm thinking my cousin and I are on the same plate. We're working together. I am actually singing, "We Are Family." You know that song. I got my family. We're working this. We're going to do this well. And then I brought her child home with me to Virginia. It was like Dr. Jekyll and Mr. Hyde. I just didn't understand what happened. I have more understanding now. I will tell you all that I am a fan of Dr. Joseph Crumbly. And that is because although I got all these degrees and what have you, these were not things that we were discussing in school. This is not stuff that we were discussing in school at all. I'm actually finding that the adoption literature that most of us don't look at kind of helps me to have better understanding in terms of what's happening. My cousin number one, the birth parent, she was having all kinds of feelings, guilt, jealousy. She didn't know what was going on, and I'm sitting there thinking, you've changed. Why are you changing? We need to continue on. I couldn't understand why she was no longer answering my phone calls, okay? And then I've got her child. Her child is 8 years old. I don't know this child from Adam. I mean, I haven't lived with her. Yeah, I've kind of seen her, but I don't know her. She doesn't know me. My cousin, I should have known something was wrong when we drove from New York to Virginia, because she was happy. And I'm thinking, shouldn't she be tearful? Shouldn't she have, be saying, no, mommy, I don't want to leave. Shouldn't some of that happen? And I'm thinking, wow, this is easy. Lots of stuff to unwrap, lots of stuff to unfold, attachment issues, loyalty issues, anger, grief, a whole lot of stuff. Family dynamics are real. And from what I can tell, most people aren't talking about these things. They're not talking about them. Suzette.
Yes, ma'am. First of all, I just want to say I love you, love you, love you. You are just right on target with everything. I am a grand family, and what happened was, having the background of being a foster parent, when they called me about my granddaughter, I already knew that benefit comes with being in foster care. You get the stipend, you get the daycare, and da. So she was like a week old in the hospital. When they called me, my home had been closed, but I was still approved. And they said, Miss Brown, can you take her? Her mom is one of my 10 children we adopted. And I said to them, I don't have a bed. I need to find childcare. But what I was doing was buying time for the 72 hours for her to be deprived in the court. And it worked. I got her. I ended up with being a foster family, whatever they call it. But then I ended up got permanent custody. So now we get the permanency, legal kinship subsidy until she's 18 years of age. My organization, I mostly deal with families children, they're just like everybody else. I don't want my grandchildren. I want to rescue them now because I don't want them to go in there. And I say to some, and I can say this to some, but I can't say it to it all. Sometimes it benefits you to go in there, call me, and they are good because most of my families I have now, they're struggling tremendously because they get no benefits. So what we're doing is I work in partnership Navigator program here in Fulton County, and we try to get them guardianship. And I just wanted to say that you're wonderful, and I'm so glad you are talking about this, and I look so forward to talking to you after this.
Definitely. Well, I'm very serious about building a grand family workforce. I have definitely talked to the people in my state. Gail Comier, I might be messing up her last name, who has come to be part of staff at the National Federation. Folks know that I am very serious about this. My life changed drastically when my cousin came to live with me. Like I said, I was singing "We Are Family," and I'm thinking, okay, we good now. I had no idea about the family dynamics that were going to come into my life. Sounds like you had the benefit in that you had been working in foster care, so you knew how to use the system to get what you needed to get. Most people don't know that. Most people don't know that. And the cases are complicated. In a lot of instances, the cases are complicated. Now, the thing that I also think needs to be said that a lot of people don't say, and Kimberly, I think I see your hand as in you have a question in just a second. Let me just get to these last 2 points. We spend a lot of time thinking about the children, and we don't never address these adults. Here's the thing. You know how when you get on an airplane, they say, give the adult the oxygen first and then give it to the child? If you don't give that grand family head the oxygen that they need, you're going to have some other issues. I know that I was frazzled because I put her needs first. I put her needs before everybody's because I thought she's a child, she needs me, all of these things. I was that child who wanted to do stuff right. So I didn't get in trouble. If you went to the principal's office, it was because the principal was saying, she has done something good. I was in the principal's office dealing with the school social worker or somebody every week because something was always up. My child had busy hands, as in she could take things that didn't belong to her. She also, I guess, was getting out her anger and frustration by beating up other kids. So I had to bully. There was a lot of stuff that was going on. And when I tried to connect with mom, mom would tell her stuff that I was thinking, why are you doing this? Why are you doing this? We could be working together. Why are you telling her to be bad intentionally? All that's going to do is hurt her more. Now, there was someone that just did a presentation right before me. She was talking about children and substance abuse. And I sat in her session and I was really glad about some of the things that she said. I had never recognized the impact of some of the substance abuse presentations that are available to children until I sat there with my child. I have been trained to do substance abuse prevention and treatment. I'm licensed, got certifications, all of that. But it was something new when I saw my child come home from school and say, my mommy's not a bad person. And I was saying, no, your mommy's not a bad person. Mommy has a problem. Mommy, has a substance use disorder. Yeah, mommy has a substance use disorder. She said when they were doing the substance abuse presentation, they were talking about these bad people. And I was thinking, oh no, this is bad approach, bad approach, bad approach. Don't ever need to tell children like that. In fact, you lose all credibility as soon as you say that about my mommy or my aunt or my whoever that I like, that is nice to me, and you're gonna call them a bad person? Lots of stuff, lots of stuff. Again, I think it was Suzette was talking about money. Yeah, there's a need for some funds. Now, here's the deal for me that's not like other people. So I walked in to a case different from most people. My child had been adopted by her grandmother. 4E money, which is what she had, Title 4E money, follows the child. So I step in and become guardian. As guardian, it was already set up for me. So I had Medicaid for her when she came with me. No, that wasn't all the expenses that I need, but that was helpful. Paying for those medical bills, that was helpful because I did have her in physical health issues, you know, basic. She wasn't, she didn't have any challenges physically, very healthy physically, but in terms of mental health kinds of issues for the counseling and what have you, you know, I could at least get some payment for that. Since I'm a clinician already, I could at least say, hey, y'all, who in our network, you can't be close friend to me, but who in our network do we have that I could potentially get to see my cousin, somebody that's good. I don't need anybody that doesn't know what they're doing, but who can be there? Most people don't have that, and they need resources to do that. Now, there were a lot of things that I did pay for out of pocket because there was sometimes people were saying things to me and I was saying, that's crazy. No, I'm a clinician. I know that's not right. I need these assessments. But again, a lot of people don't know that and they don't have any funding. And so there's need to support these families. Okay, Kimberly. You're
Sorry,
muted.
yes, I forgot to unmute myself. I'm also a foster parent, and my grandson that I have custody of, prior to our adopted daughter giving birth and all of the struggles that she went through with mental health, she was actually born addicted to substance and has fetal alcohol syndrome. So we've been through the gamut with her.
How old is she?
She now is 23 and has had another baby. And I said, no, somebody else needs to step in. But that's a different story. But also going through educating myself on mental health and substance use. How can I find the resources as a parent, and she was still minor, on how to find the support that our family needs, because we have a lot of children who are adopted through the system. And unfortunately, here in Virginia, the agency looks at the children in care as a number or a piece of paper and not as a human being. And when I would ask our county, the caseworker, we need X, Y, and Z. Oh, well, you need to go to the FAP team, which is the family planning team, to see if you can get the X, Y, and Z. They'd act like they didn't, like I didn't know what I was talking about. And I would give them my research and my documents and everything that my child needed. So our family was closed, like we closed our house because we have 8 kids. And yeah, we're part of that kind of help the community family. But I saw the writing on the wall while my child was pregnant. Need to get our house open again, just in case.
So I am hearing you loud and clear, and I am laughing because there were a couple of times when you said stuff where I was laughing. Y'all, I wasn't laughing inappropriately. I was laughing out of knowledge. I'm Dr. Glenda Clare, went to the College of William and Mary, have degrees in counseling, educating counselors. I had clinicians who had master's degree, which means that I was above them and they could be in my classes, right? Saying, oh, Dr. Clare, you just don't know.
Oh, yeah, exactly.
And I would say, excuse me, excuse me, master's level person, what? What did you tell me?
Oh,
Yes.
I was given therapists documents and books like Karen Purvis's books on attachment to read. We were paying for them to help our child. But anyway.
But
so-
they don't necessarily get it. It's
No.
threatening.
They
And
don't.
part of, okay, so you see www.fragilefamiliesnetwork.com.
Yeah.
Part of what the mission of the nonprofit that I founded is two parts. One part is to provide supportive services to grand families, having an understanding of what the needs of grand families are.
Right.
But part two is educating health and human service professionals who are supposed to help the grand families. Most of them are clueless. Most of them are clueless. I'm telling you, this is not part of what we study. As I have gone further and gotten into the adoption literature, and I didn't know this at first. I'm trying to remember why I found Dr. Joseph Crumbly. Once I found him, I was like, oh, I need more of Dr. Crumbly. What else is he saying? Where is he saying it? What have you? Because he was the first person that made any sense. Nobody else made any sense. And I'm sorry, there's a whole lot of people still out here now that don't make any sense. He is the only one that made sense. And then here recently, within the last couple of years, I've gotten involved and gotten certified in terms of the adoption information. And the adoption information makes sense. And so it makes sense for grand families because, okay, let me just give y'all a quick 101. I'm looking at my time as I'm doing this because I have two activities for you all to do. So here's the thing. There's a birth parent and then there's a child or children. I want you to think of a family tree, okay? So in a family tree, you have the parents here, and then you have the children underneath, correct? Grandparents are over here. If there are siblings, they're on either side. Well, when you change the dynamics of the family by having someone else raise the child, everything is changed. Everything is changed. The whole formation of the family changes. When grandma is raising the child of her child, the relationship between the birth parent and the child change. They're now on the same level as though they're siblings. The relationship with aunts and uncles change if grandma is raising them. And so do the relationships of other grandchildren. There is so much craziness that can come out of this. Crazy making, which actually is normal. However, if families know about this, if you are having discussion about this, then people get along better because they have understanding. There's a process that I learned about called family group decision making that makes sense. It makes sense. It then puts everybody at the same table. So I think in the family peer support world, you use child and family team meetings. This is kind of sort of like that, but not like that. So here's what the difference is. The difference is that a family decision-making meeting is basically one where all of the family members get together there. The birth parent is there. Depending on the age of the child is there. Other key members of the family are there. So cousin Susan, Uncle Tom, Linda, who's been our childhood family friend, all of them are there. And they have social services or whoever is in the know come and tell us, okay, so what's happening here? What's happening here? And why is this happening? The family makes some decisions about, okay, now what do we need to do? Susan, who's the mother, you saying that you want to get this together. Let's say Susan's a substance abuse. Okay, well, the family as a whole is going to decide, then Susan, you need to go to drug treatment. And we need to go ahead and get you in there and work on whatever and give you a timeline by which you should have XYZ done. But we also having a discussion about what happens if you don't get that done. We need to be discussing honestly with this child, say the child is 12 years old. We need to be talking, mommy's got an issue. Mommy's got the substance use and mommy needs treatment. Mommy's gonna go into drug treatment. She's going to do this and that and what have you. And mommy is going to say to the child, with grandma or whoever there, they are in charge. I trust them. You need to listen to them. You need to do what they say to do, how they say to do it. I support all of this, whatever. People need to come together and work together to get some of these kinks out. And what I'm saying, does that make sense, or do y'all think I'm crazy?
No, it absolutely makes sense.
It makes sense. It makes sense. It makes sense. You know,
we're not doing that now. We're not doing that now. We need to do that. Another thing that I have said, this is my idea, not Dr. Crumbly's, because now that I know his stuff, I know his stuff. I agree with some stuff. I don't agree with some other things. But, you know, typically when we are dealing with families, and I think there's a role for peer support, but there's also clinical roles. There's some need for some real clinicians in here with some licenses to do some stuff. We need consistency, however. We don't need that clinician who's just fresh out of school that, I don't mean no harm. They don't know nothing. They just got out of school. We need clinicians that are going to be there. They're going to be having their practices. They're not going to be going from this practice to that practice to that practice like your newbies are going to be doing. You've got some old time clinicians that are going to be committed to family. No, you're not going to need to see the family for once a week for the rest of their lives. However, you are the holder of history for that family. We need continuity like that are working with us. Continuity, exactly. Now, I know that something told me that there were 2 other hands that were raised. So, Kimberly, put your hand down.
I put it back up.
Hand down.
I put it back up.
Oh, you put it back up? Yeah, but there's some other people that had some questions. So, wait a minute, let me see who they are. They were going to say something. So, let me take this down so I can see who they are. And then I move the hands away. Okay, Kimberly, go ahead.
Okay, my issue is that our adopted daughter feels that I stole our grandchild. And so I remind her that it was her choices and CPS showing up at our door and preventing our grandchild going into foster care.
I understand.
And
I have kidnapped as well.
And
women
at my age, like I need a baby.
As the kidnapper, the mama put the child in the car with me, and I have to remind them, you packed up the clothes. You put them in my car. Don't you remember? Did you forget that?
Yeah.
I called you every week. You refused to answer the phone. Did you forget that? What kind of kidnappers do that? Yeah. So, you know, when you're dealing with guilt, you're dealing with jealousy. You got to figure out something to say because you're not ready to take responsibility.
Yeah, I just think it's very harmful. And during our last visit,
but it's real. It's
we had
harmful, but it's real. But here's the thing that you have to keep in mind: sick people do things like that.
Oh, that's true. I keep forgetting that. That's so
sick
true.
People do that.
Yeah.
Danielle, you're next.
Yeah, going back to what you were saying about the clinicians basically being green straight out of school. Everything they learn is basically from a textbook, right?
Yes.
And they don't have the experience or even life experience, because like I always say, experience is the best teacher, and it will grade you first and then tell you what you did wrong. But anywho, I think also some of the problem with the clinicians, I think that a lot of people, especially in this field, get into the helping profession because of either their own life experience or just a deep impacted sense of wanting to help other people. However,
I knew you were going there.
However, because it's the flip side, I also see, I've been doing this for a little over 2 years now, and I also see some of the red tape that makes a lot of the clinicians who usually go into it for the right true core reasons of going into this work become disdain with it, and they either fall into the whole rhythm of quote unquote the system and how everything is, and they're used to the red tape and everything, that they lose their passion for why they got into this field in the first place, which is why we have these perpetuating cycles of families and children falling through the cracks of the system.
I agree. I agree. I agree. Julia, I know you was getting frustrated. I saw your hand up there, so go ahead and talk now.
No, I'm not frustrated. I just didn't want to lose my train of thought because I had something I wanted to say before I want to say this. But anyway, wanted to just speak to when you were saying, does it make sense for, everybody to get around and have a conversation, about what's going on, including the child. And I just wanted to speak to that because, I've lived that, and I had enough, I guess for lack of better words, sense to know that when I was struggling with my substance abuse that I needed help. But I knew, because, I have and I have always had strong faith in God, that, I wasn't going to stay in that state. And so I reached out for the help and I had the conversation, but I don't know that, the family members thought that I would ever, come out of that lifestyle. I don't know that, I think trust is a big thing. I know that they loved my child. But the things that, sometimes when you have to make decisions, you don't want to put your kids in the system and all that stuff. Some family members, it's a safer place than the system, but it's not always the safest place, if that makes sense.
I agree. It makes sense.
Okay for a moment, which helped me and motivated me to really, really get myself together so that I could get my child home. And it was a lot involved with that, even with the conversations, like, that everything has to come to an end. Like eventually the best place for that child to be for a parent that, is working towards, getting themselves together is to be with the natural parent. And, some family members don't know how to let go, don't want to let go. But
I understand. I'm going to tell you, Julia, I hear you. I have worked perinatal substance abuse. I have seen some moms, biggest motivator, got to get my child, biggest motivator. I've also seen those moms, couldn't do it. And we don't know that you can do it until you do it. Okay. I got a mom right now. Oh my goodness. This is 20 years later. She's doing wonderfully. I am so proud of her. She's doing wonderfully. I have others that are dead. I have others that are still out on the street. They trying, but they just, for whatever reason. And now I'm not going to judge any of that because I know that a lot of stuff, it takes a lot of stuff. Nobody is born and growing up saying, when I grow up, I want to have a substance use disorder. Nobody's doing that. However, also hear the other piece, that family is also concerned about this child. Now, what if you relapse? You relapsed before. What if? I agree. And some of what I'm feeling needs to happen. And I'm looking at my time, so I'm not going to do, well, I'm going to speak to, but I'm not going to do some of these exercises that I was going to do, because one of the exercises that I wanted us to do was to look at the family. So I'm mentioning the grand family as in that family now that has been recreated without the birth parents' presence. However, the reality is family would not be there if they didn't care about that birth parent. They wouldn't. That's why they're there. They're there because there's some level of caring about that birth parent. So when you look at foster care and adoption, they don't have no relationship with the birth parent. So for all they care, whatever with the birth parent. The first relationship that family has is with that birth parent. That's the first relationship. That's why they even care about that child. It's because that's Julia's child. That's Susan's child. That's why they care about it. I do think that there needs to be some piece of work that's done with that birth parent. I do. Because I don't want to give up hope for Susan, who I love. Now, I got to change up some of what I have to do in terms of the taking care of the child, because Bottom line, I don't know what you're gonna do. I do know I need to keep this person safe. I do know I need to help this person get their education. I do know I need to do that. However, if reunification is possible, I'm gonna want reunification, because bottom line, I don't care how much that child may appreciate me and may love me, I ain't mama. And my feelings have been hurt, truly. I know, I'm not mama. Bottom line, I am not mama, so I am not the priority for that child. Not. And even, you know, somebody was saying, so somebody said earlier something about the age of the child. So here is what I know. You may have picked that child up from the hospital. And so you may be the person that they identify as mama or daddy. However, if at age 10, 12, 15, 30, they find out that, oh no, you're not really the mama or daddy, they're gonna rechannel that. There's a whole new processing that comes, and you can't get away from that. Julia, you're on mute.
Yep,
Julia,
this is Kimberly. We went through that with our child.
Yeah,
and the
so that
grass
part is
was not
real.
greener on the other side, they found out.
Well, and it doesn't have to be greener or not. The whole thing is there is that curiosity.
Yes,
There
I
is
agree.
that wonder. There is that, I want to know. And it's natural. And even though we say, well, you know, the child is born, that child was in that mama's body for 9 months. There was some kind of bonding that went on up in there. And so we need to be
Glenda.
real about that. That really did happen.
Yes.
There is a real
Yes.
experience. There is.
Dr.
Deborah,
Glenda,
you
can
got
I-
your hand up.
Yes.
Deborah Price has
Can I
her
say
hand up.
something?
Well, okay, and then Deborah Price, Suzette, and then Deborah Price.
Thank you. I just wanted to say that that is right on. That's the bullseye, because that's why when I was fostering, all 10 of my kids I have an open door to biological connections. And it's so ironic that this morning I was talking to my son, who's now 26, and I said to him that your birth mom will always be number one parent. You know what he said to me? That's not true. I said, it's not true. He said, no. He said, I don't know.
He said, what? You broke
You're
up.
my
You
number
broke
one
up.
parent. But okay, I said that I said, birth mom will always be number one because they brought you on this earth. And he said to me, that's not true, mama. That's not true. He said, because I don't know my birth mom. Therefore, you will always be my mom. I said, okay. And I left it like that because as long as he has that thought process, that's fine. I'm not thinking for him. And that's what happens with adoption. A lot of adopted parents think for children and say they don't want that birth parent connection. And it needs to be. My granddaughter had a connection with her biological mom, but her biological mom's relationship was becoming toxic and had the granddaughter cutting, depression, anxiety, a whole bunch of. We had to separate that for right now. I told my daughter what was going on in a very nice way. She took it all, turned it into something negative. So now we're not speaking. She done went out there and talked to the Joya's dad, and my granddaughter's dad, and it was a mess. So, but you know what? I have peace because I am working on behalf of my daughter, saying that she can't ever have that connection. I would love that to be.
You know,
counseling when she was younger.
You know, I think that we can teach birth parents some things that they need to know. And Julia, you comment. I'm going to share a story. This is a real story. So there's this woman that I'm doing some work with, and she has had 2 child welfare cases. The first child welfare case, she was deep into her addiction. She lost custody of that first child. She lost custody. She got pregnant, had a second child. Child welfare was involved. She worked her buns off to get custody of that child. The second one, she worked her buns off. And did well. She had birth parents, my client's birth parents were not in support of her, but her uncle, her godfather, has been wonderful support. He and his wife supported her all the way, believed in her. She did everything that she needed to do. She got back that custody. But she also did, and I'm, trying to get her to go live. She's doing some things now to begin talking about it, but she worked her buns off to develop a relationship with the adoptive parents so that she has a relationship with her child who has been adopted. He knows that she is the birth mom. They celebrate birthdays and holidays, and they all come together and doing different things together. She knows that she needs to be honest about that. She didn't do what she needed to do for that relationship, and he needed a mom and a dad to be there then. But I do believe that these relationships can be, especially among grandfamilies. I do believe that that can be, but that does mean that the families have to do some work to get all them dynamics settled. Because, I'm going to be honest, Crumbly talks about loyalty issues. Yeah, I had them. Yeah, I had them. I was called cousin, not mama. Issues in terms of I was trying to do stuff to get them reunified. Wanted her to be mom, wanted different things to happen. She wasn't ready for whatever reason. A lot of hurtful things can happen, but you have to be willing to do the work to repair the family. No family, anybody here from a perfect family? I'm waiting for, well, Deborah got her hand raised, but her hand was up before. So, none of us are from perfect families. So we all have issues of some sort that need to be resolved. We need to know that part of this work, part of this, I think, grandfamily peer support, which I told you is, I believe is different from family peer support work, needs to include some of that stuff in it. Can you put your contact information in the chat? Yes. So here's what I'm going to do. Actually, I'm looking for, I'm going to put my PowerPoint back up. I'm looking for going through past my slides because since we didn't do my exercises here, I'm looking for people to get involved with me in what's called a Grandfamily Workforce Boot Camp. I'm looking to do a boot camp. Julia, prior to coming on, I had thought to put in this survey that I'm using for the boot camp, a piece about birth parents. It's not in there, but if you will fill this out too, and just put in there that you're a birth parent. Is that something that you might be willing to do? I'm gonna give you all of my information is here. So here's can y'all see my email address and the website address? And then I'm gonna put the boot camp information in the chat. I hope I can do that. Let me see. Nope, that's the fact sheet. Okay, let me put the boot camp information and my information in the chat. So what are y'all thinking? I'm going to go around the room and ask people about their thoughts in terms of this whole concept of this grandfamily workforce. I know, like I said, that I have been talking to officials in my state, North Carolina, and they're saying, yeah, the more you talk about it, we kind of need this. We need to have this workforce specifically for grandfamilies because regular family peer support are not prepared to work with this population. They're not. I have talked with people all over the country. On the board of directors that I have for the organization that I founded, I have a Latina, I have a Native American, I've got, including me, 2 African Americans and a white grandfamily member. So I've got representatives from the grandparent, the aunt, the cousin, and the fictive kin from the different races and ethnicities. No, I don't have Asian, because Asians are hard for me to find. I don't know why, but they just seem, you know, they have a tight-lipped culture. They don't seem to share. I'm sure that these things happen in their culture. I know someone that's Filipino that has had these issues, but actually a fictive kin actually raised that child. A white step-parent raised that child. But what do y'all think about this whole concept? Shared a lot here today.
I'll say I learned a ton because I'm not gonna lie, when I first seen the title, I thought it was, you know, grand, you think of grandparents, right? That's the first thing you think of. So that's why a lot of people was mentioning grandparents, myself included. But I did learn a lot, and I learned you know, to look at things from a different perspective, and that system involvement is not always necessary when raising, you know, a family member's child.
And most family members don't want the system. They don't. Melissa?
One of the experiences that we have, and we come up a lot, and we're a very diverse group that we work with parents, and we define parents by any caregiver. It doesn't matter how the household is, if it's 2 dads, 2 moms, an aunt, uncle, however it is. We work with all of them. And the benefit that we have is you do not have to be in the system to get our help. So I think there needs to be a lot more of that, because there are so many people that we come across that they've worked for 2 generations back to be out of the system. They're not going back in. They're just not. And I feel like that there needs to be more programs out there, more organizations that say, we're going to help you. And it does not matter that you're not in the system. We're not part of the system. And it's a free service, because they deserve to have that choice too, and not go back in the system just to get that kind of help that they need.
Now, I'm going to tell you one thing. I got an issue with free. And I'm going to tell you what my issue with free is. People sometimes don't appreciate it if it's free. Sometimes people will say, oh, wait, you know, now that's free, so that's not as good as it. So sometimes I feel the need to not, you know, charge the highest prices, but have something, because I need for you to put some commitment into this. I need for you to say that, yeah, I'm willing to do some extra whatever to get this done. And sometimes with free, they don't do it. And I need for them to put more than their pinky toe in. Crystal, you're next.
Well, it's although I don't disagree with what you know, in Pennsylvania we have a broad spectrum of who the caregivers are. That is true, but it's very unusual. I can sit in a group and have people not, because I can sometimes see it on their face or their way they question me. You know, my experience as a grandfamily comes from doing kinship care with juvenile justice, as well as raising a niece and a nephew, and my own children. And several of my children it actually came through adoptive. How do I say this? They were adopted out of the system, and then they came to me through their adoptive parents, which is kind of unusual, but that doesn't always seem to think. I always don't, you know, like, you're very accepting of the fact that, yes, I did the hard work. But that may not always be true in some circles of family members when you sit with them. And
oh no, I agree. I agree.
They don't even have to say anything. You can just see by their body language or their face. Like, somehow, if I didn't give birth, it did, you know, my experience was somehow not quite the same. So I do appreciate this. And I really do believe, and it's I'm helping in Pennsylvania work on the family peer support specialist certification, and the broad reach of what we're looking at. I'm very insistent needs to stay in it, and those groups need to be welcome as well. I would love to know more about what you're building. Thank you so much.
I will let you know that what I am building is being built upon that basics with the family peer support, because I do believe that that information is needed. I don't think that that's the only information. I think more information is needed. And I think that the more needs to be with people that have lived experience, because I don't think
Absolutely.
other people understand it.
Yeah, absolutely. It's not a straight trail we follow when we're not the birth parents, you know, so it's interesting life experience we have. And I'm looking forward to filling out your thing on Survey Monkey on the boot camp.
Awesome, awesome. Now, Melissa, I don't know if you put your hand back up. I'm not sure. Did you? Deborah, I see you came up, so that must mean you need to say something because you just popped right in front of me.
Okay, I don't know which Deborah you're talking about me.
Yes,
Right.
Deborah Price.
Okay.
I'm sorry. I didn't know.
No, I originally had my hand up, but I just wanted to say that because I was going to tell like a little piece of my story, but I can hold off on that. I want to know, like, how are we able to meet back up and continue this discussion, because I feel it's so needed. I just remember feeling so isolated and so alone in so many areas of my life after doing this, that I was just like, there's nobody that's here for me to help me through it, when that's what I was doing for everybody else. And it was just, I would love to be able to provide that support to someone else that's
So
going
Deborah,
through it.
then that means that Survey Monkey, you need to go ahead and fill it out. And I definitely, so here's what y'all need to know. This has taken over my life because the child in my life is 28 years old now. So she's not living with me anymore. She is a grown-up. But this has I don't want other people to go through what I went through the way that I went through it. I think that if you have more information, if you have more people that are around you that know, that if you have more people that can support you, the better. In 2018, now my journey started in 2003. In 2018, I became a part of a group called Grand Voices, and they are grand family members all over the state associated with this organization, Generations United. I told Generations United, oh, I want to interview them. Oh my goodness. I interviewed people and I was like, oh, I have found home, because I finally spoke to people who were having a similar experience. And I was like, you too. I wasn't finding that anywhere else. I wasn't finding that with my family, as in my mother and my aunts and my uncles, who I would try to explain what was going on, but they were clueless. They didn't understand. They just didn't get it. Because too, okay, so my mother and father divorced when I was 3. So I spent most of the time with my mother's family, which was not the family of my cousin. They were my father's people. There was nobody for me to talk to. My cousin went through this stuff of, not only did she have happy hands that would take other people's things, but she also then went through a period of self-mutilation and then burning things. She was setting things on fire. And I was like, what do I do with this? I, at one point, had to put her in an institutional placement, because my mother was like, look, this girl is setting things on fire. She can kill you. So we had to do, some of that, but I struggled with that. And, this isn't even my birth child, but I was there every single day. I need to see how she's doing. I don't want her to feel like she's alone. There's a lot of stuff that comes with that. When she was stealing stuff, I got uninvited to Thanksgiving and Easter and Christmas and what have you. At some point, I stopped going out. So she is 28 now. She is right now into her mama. And I'm saying, well, she's never been around her mama. So let her do that. She also just had a baby. So she needs to do some of that. And quite frankly, I need to have some separate me time too. Which is good, because I did some of what I think that was Deborah, not feeling like I needed to have there was nobody for me to talk to, didn't have a support group. Doing some of what I'm doing now is refreshing for me. It's helpful for me. It's helping me to make sense. I call it making lemonade out of lemons, because I did have a lot of lemons. I gave up a lot of stuff. I had gone and gotten this doctorate and really couldn't use it because I was dealing with the stuff that was going on with her. So yeah, there's a lot to that. So I think we have 4 more minutes. I want any more comments. So Kelly, Tabitha, Danielle, Alyssa, Gail, Miss Melendez. I haven't heard from Miss Melendez. Now, you know I'm used to hearing from you. Jan, I haven't heard from y'all. Betty Jo, do y'all have any comments? Julia, I do see your contact information, and you do have mine, right?
Okay, if no one has any comments, Dr. Clare, it's okay.
It is, but I wanted somebody to have some hope.
Okay. Well,
I do have a comment.
Okay.
So I just wanted to say that I definitely enjoy both yesterday and today's presentation by you. I think that you are a very lively presenter. I think that you are very down to earth. I appreciate it. I've seen you, you were an audience member in one of the presentations, and you were saying how you was like, you the troublemaker, you the something. And I was just cracking up because I just thought I was like, first of all, that's so mean. And then secondly, I just really admire when somebody can be themselves besides their degree, besides their lived experience, besides, their status and everything, and just be who they truly are at their core, and all those other things are secondary. And I just really enjoy seeing you present. So I just want to say that.
Thank you. I appreciate that. I can only be me. So
I know that's right.
Everybody doesn't like me.
Dr. Clare.
Listen, I know that.
Dr. Clare, this is Suzette.
Yes.
I know that from experience.
I just want to say one.
Yes, ma'am. Suzette, I can't hear you.
Prayer. God grant me now.
Okay, I can.
You hear now?
I can.
God, the serenity prayer. God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. That is my backbone.
I hear you. And I have definitely, as a substance abuse counselor, I've definitely been in those rooms. And yes, just for today, I can do that serenity prayer. Another thing that I'm just going to throw out, and you'll see it on our webpage if you look at it. So we're www.fragilefamiliesnetwork.com. If you look under services, if you look under ministry, we have started having parents of addicted loved ones groups, support groups. So we do that every Friday. We didn't do it this Friday, but we do it every Friday from 12 to 1:30. And those groups are powerful too, because, it's hard when you see that your child is addicted to a mood altering substance and you're not really sure what to do. And that mood altering substance, that's one of the main reasons that children go to live with their relatives. So dealing with those issues, yes. Oh, we're at time. So everybody, y'all have the survey, y'all have my email address. I'm going to save the chat so that I can get people's information that is here. But let me let you know, sometimes, I shut down after these events and I'll say, there was something I was supposed to do. What was that? So you have my email address so you can get in contact with me. So thank you so much. Yes, great. I'm glad to see you all here. And I can't believe that Miss Melendez was quiet, because she yesterday she was talking all throughout the session and she was quiet. I'm like, Miss Melendez, really? You're on mute. This is just unlike you. You're on mute. I can't hear you. You're on mute, Miss Melendez. You're on mute. You're on mute.
Thank you. And listen, everything you're talking about, I never known. You never know, see, I have a different position in one future. That's why I learn. So of working with family, sometimes I only one time I have one family pass like the lot of issue, but I'm glad everything you talking to us, everything you experience really touched my heart.
Good.
Touch my heart really is something like you never expected happen to you, pero it can be.
It can be.
It can be. So thank you so much for everything you talking to us, teacher to us. I learned today.
Thank you. Thank you.
God
Okay,
bless
well,
you.